So I was anti any of that because I came from a family of addicts. And, what do people say with pot? It's a
Yep.
gateway drug, right? And
Gateway drug.
but here's the deal. What I saw with my family was you either had that or you were on the prescriptions, right?
Yep.
And so I was totally, my kids say no to drugs, da da da. And, my daughter, who is 25 now, when she was 17, was diagnosed with epilepsy. And she was having over 52 seizures within a 24-hour period. And so my oldest one that came home from Austin, keep Austin weird. She's now a doctor. She's now a doctor, but there's that open discussion of mom because she could not get rid of her headaches. Even prescription medication did not take care of her headaches after she'd have a seizure. So it took my kids educating me and talking to a doctor that prescribes it to understand if this helps her, then we need to look into it more. And it's been a game changer for her. It's a game changer for people like that have Parkinson's. Yeah. It's a game changer for people that have epilepsy. Cancer, yeah. But it's very important, like Carla said, to have it monitored, to make sure you're getting your checkup. Because if you start doing that with other stuff, it can become not so safe.
Just like the painkillers or anything else, when you're overusing something, it can become dangerous. Yeah. And marijuana can become dangerous. And I've seen it myself in the ERs. It can become dangerous when people are overusing it, just using it for a high, right? So that's where you have to really make sure that, you're using it for the right reasons.
Yeah, and I think you both agree. I think with more research looking into this, I think it's a viable thing. It's been around for thousands and thousands of years, so I think it's a viable thing.
Your kickback's you're going to get a lot of kickback from pharmaceuticals.
Of course.
Because listen, if it can help 5 different ailments and you get rid of the medication that's produced by the pharmaceutical companies, they lose money. And so I think you've got a lot of push. I think that's why we've seen so much resistance on cannabis, because money is going to be lost. And to me, we need to be researching this all the way around.
Yeah, if you've got a pill that makes, $10 billion a year and someone grows a plant in their backyard that replaces that, you're not going to be happy, right? Yeah. You are not going to be a happy camper. And the thing is, it's just the stupidest stuff like hemp. The original dollar bill was hemp, was made out of.
I did not know that. They have lotion.
And just canvases. A lot of the great artists, their canvases it was hemp canvas, instead of cloth. So hemp itself just can be so many purposes, but it's just the stigma of it. But in any case, we can go down that rabbit hole now. But look into Dr. Joseph Rosada. He's awesome.
I will.
We definitely
He is, really. He was on a podcast a couple months ago. He'd probably jump on your guys' podcast in a second. And he's brilliant about this stuff. And he's not cuckoo woo-woo. He's not a drug addict. He's a serious medical doctor who studied, who's surgeon, and he left the medical profession because he said, this isn't the way, Well,
you have life is about these like waves of going through the motions, and one thing's popular at one minute and the next thing it's not. And it's the same thing as your holistic doctors. We're even seeing, doulas, instead of women going to the hospital and having births and getting the epidural, they're doing it at home naturally. So I think you're starting to see a shift, and hopefully it's a good shift.
Take away from medical professionals.
No.
There are many very, very great professional, responsible medical professionals doing great things for people. Yeah. So they're saving lives every day. So I don't ever want to.
I had a cardiac arrest in February, and a doctor saved my life, right? So I'm not going to talk trash about doctors. I couldn't have gone down to the weed store and said, hey, I'm having a heart attack. Do you guys have anything for that? It wouldn't have worked, right? So doctors.
Tried, though. That'd have been like, I got some good stuff back here.
I think there's room for both, but I think there's room for both. Again, having that healthy balance, what that looks like.
I'm going to come to Dallas, and me and Brandy are going to eat some gummies and have some giggles and forget
the whole thing.
You're going to take care of some mental health issues. Yeah. This is what I'm talking about.
Be the professional here, Yeah. You and I'll be laughing.
Just don't mix it with Jameson. That's all I'm saying. I don't know how that's going to work out.